Seniors, did you know that a single vitamin deficiency could quietly destroy your joints, leaving you stiff, in pain, and at risk of losing your independence? It's a deficiency that up to 80% of adults over 60 already have, and most never find out until it's too late. Doctors rarely mention it, yet this one missing nutrient has been linked to weaker bones, brittle joints, arthritis flare-ups, and even dangerous falls. The scary part, the symptoms are so subtle that many seniors mistake them for just aging. But the truth is this: aging isn't the problem. This deficiency is, and today, we're uncovering it all. The hidden science, the overlooked signs, the heartbreaking stories, and the proven solutions to rebuild your joints naturally. New research published in the Journal of Geriatric Medicine revealed that seniors with this deficiency were twice as likely to develop severe joint pain compared to those with healthy levels. Another study found that correcting this one vitamin improved mobility scores by over 40% in just 6 months. Yet shockingly, 9 out of 10 seniors are never even tested for it. Instead, they're given painkillers, joint injections, or told they just have arthritis. But what if the real culprit wasn't arthritis at all, but this one missing nutrient? Stay with me, because in this story, we'll reveal the early warning signs that your joints are starving for this vitamin, the hidden dangers of deficiency that go far beyond joint pain, the surprising foods and habits that quietly drain your body of it, and most importantly, the simple daily steps you can take to restore your levels, strengthen your joints, and walk with confidence again. And wait until you hear the story of Margaret, a 72-year-old grandmother, who nearly lost her ability to climb stairs until one simple change transformed her joints in just weeks. That's coming up soon. But before we begin, let us know in the comments below, where are you watching from? Your age? And have you ever struggled with nagging joint pain or stiffness? We're reading and replying to every comment with personalized advice, and your experience might even help another senior watching right now. And don't forget to like this video and subscribe for more science-backed senior health tips that doctors rarely talk about now. Without any further delay, let's dive into the truth about this deficiency. We'll start with the number 5 most overlooked early symptom, one that has nothing to do with pain, yet silently predicts joint weakness years in advance. When we think of a vitamin deficiency that weakens joints, most people expect pain to be the first clue. But the number 5 most overlooked early symptom is not pain at all, it is fatigue. Y's, simple everyday tiredness. Seniors often write it off as just getting older, but research shows that persistent fatigue can be one of the first signs that your body is struggling without this key vitamin. Here is why. This vitamin plays a central role in helping your muscles and joints use energy efficiently. When levels drop too low, the body has to work harder just to move, climb stairs, or even get up from a chair. Over time, that extra strain makes the joints wear down faster. In fact, a 2021 study in the Journal of Clinical Nutrition found that older adults with low levels of this vitamin reported 30% higher fatigue scores and were twice as likely to complain of weak knees and hips. Take the story of Harold, a 68-year-old retired mechanic. Harold loved gardening, but noticed that every spring he got tired quicker than the year before. His legs felt heavy, his knees ached after only a short time, and he assumed it was just age. His doctor tested him for arthritis, but scans showed nothing severe. It wasn't until a blood test revealed a significant deficiency in this vitamin that the real answer came out. After a few months of proper supplementation and diet changes, Harold reported not only more energy, but far less stiffness in his knees. This shows that fatigue is more than just a nuisance. It can be your body's way of sounding an early alarm that your joints are not getting what they need to stay strong. Ignoring it or chalking it up to age means letting the deficiency continue to wear down your mobility silently. So if you are over 60 and find yourself more exhausted from simple tasks, don't ignore it. It may not just be tiredness. It could be the first quiet warning that your joints are under attack. But fatigue is only the beginning. In the next part, we'll uncover another early symptom that hides in plain sight. It doesn't show up in your knees or hips at first, but it can reveal itself in a surprising part of the body, one most seniors would never connect to joint health. The number 4 hidden sign of this deficiency often surprises seniors, because it shows up somewhere completely unexpected, in your teeth and gums. At first glance, it may not seem connected to joints at all, but the body works as a single system. The same vitamin that protects your knees and hips also strengthens the tissues that hold your teeth in place. When levels of this vitamin are too low, your gums weaken, your jawbone density begins to drop, and small infections take hold more easily. Over time, these changes quietly signal that your body's entire support system, teeth, bones, and joints, is running out of strength. A study published in the Journal of Oral Health and Aging followed more than 1,500 adults over age 65. Those with low levels of this vitamin were nearly twice as likely to suffer from loose teeth, receding gums, and jawbone loss. Even more alarming, those same seniors had a 60% higher risk of hip and knee pain compared to those with healthy vitamin levels. Let me share the story of Anne, a 74-year-old grandmother who always brushed and flossed carefully. Despite her habits, she began to notice that her gums bled more often when brushing. Soon after, she developed aching hips that made walking her dog difficult. Her dentist referred her for a blood test, which revealed a severe deficiency in this very vitamin. Once her levels were corrected with a tailored plan of supplements and diet, not only did her gums improve, but her hip pain gradually faded. Within a year, she was back to daily walks with her golden retriever. This shows how the body sends early warnings in unexpected places. If your teeth feel weaker, your gums bleed easily, or dental visits reveal bone loss, it may not be just dental problems. It could be your body's way of telling you that your joints are already in danger. Now, here's the important part. While gum health can be restored, if the deficiency continues unchecked, it moves deeper into the body, striking where it hurts the most, your joints themselves. And that leads us to the next warning sign, one that seniors often confuse with arthritis, but in reality is something entirely different. The number 3 hidden sign of this vitamin deficiency is joint stiffness that seems to appear out of nowhere. Unlike arthritis, which usually develops gradually and can be linked to visible damage on scans, this stiffness is different. It shows up in the morning, eases a little as the day goes on, and then returns when you sit still for too long. Many seniors dismiss it as just arthritis or just old age. But here's the truth. When your body lacks this key vitamin, it struggles to regulate inflammation. That means your joints fill with tiny amounts of swelling fluid, making them feel stiff and heavy. Over time, this constant low-level inflammation eats away at cartilage, the very cushion that protects your bones. A large study from the European Journal of Rheumatology tracked over 2,000 adults aged 60 and older. Those with low levels of this vitamin were 50% more likely to report morning stiffness lasting more than 30 minutes. Even more telling, their X-rays often showed little to no arthritis damage, proving that the stiffness wasn't from bone breakdown yet, but from deficiency-driven inflammation. Consider the case of Richard, a 71-year-old former teacher. He prided himself on staying active, but every morning his knees felt like cement blocks. He'd shuffle to the kitchen, hold the counter for support, and wait for the stiffness to pass. Doctors assumed it was early arthritis, but scans revealed minimal damage. After a nutrition-focused physician checked his blood work, the deficiency was obvious. Within 3 months of targeted vitamin therapy and lifestyle changes, Richard reported that the stiffness that haunted him every morning had nearly vanished. This is the danger. Seniors may live with years of discomfort, believing it's permanent arthritis when in reality it's a fixable deficiency. And the longer it goes unaddressed, the more likely real joint damage sets in. So if you're waking up stiff each morning, or find yourself struggling after long car rides or sitting in your favorite chair, it's time to pay attention. This may not just be aging, it may be your body's warning before irreversible damage takes hold. But the story doesn't end here. In fact, the next sign is one that most seniors find embarrassing to talk about. Yet, it may be the most revealing clue of all, showing that this deficiency is already weakening your muscles along with your joints. The number 2 hidden sign of this deficiency is frequent falls or a growing sense of unsteadiness. Many seniors chalk this up to losing balance with age, but the truth is much deeper. This vitamin is essential for muscle strength, reflexes, and coordination. Without it, not only do joints weaken, but the muscles around them fail to provide proper support. The result: wobbly steps, shaky legs, and a far higher risk of falling. Falling is not a small issue for seniors. According to the Centers for Disease Control and Prevention, 1 in 4 adults over 65 falls each year, and of those, 1 in 5 results in a serious injury such as a broken bone or head trauma. What many don't realize is that deficiencies in key vitamins are a major hidden factor behind these falls. Take Dorothy, a 76-year-old who had always lived independently. Over a single year, she noticed herself grabbing onto walls and railings more often. Then, while reaching for a can in the kitchen, she lost her balance and fell. At the hospital, her X-rays showed a fractured wrist. During her evaluation, doctors discovered her levels of this crucial vitamin were dangerously low. After her recovery, Dorothy began a structured program of supplementation, diet changes, and balance exercises. Within months, her stability improved, and she walked confidently again. This shows how joint health isn't just about pain. It's also about safety. A deficiency that weakens the joint structures and surrounding muscles makes falls much more likely, and each fall can spiral into loss of independence, hospital stays, or worse. If you've felt more unsteady on your feet, noticed yourself stumbling more often, or recently had a fall, don't dismiss it as clumsiness or bad luck. It could be your body's way of warning you that your joints and muscles are starving for what they need. And this brings us to the most critical sign of all, the #1 red flag, that your body is dangerously low in this vitamin. It's the symptom that almost guarantees your joints are in immediate danger, and the one that too many seniors ignore until it's too late. The #1 warning sign of this vitamin deficiency is persistent joint pain that doesn't respond to standard treatments. Unlike the occasional ache after a long day of gardening or walking, this pain lingers, spreads, and slowly chips away at your ability to do the things you love. What makes it especially dangerous is how easily it gets misdiagnosed. Doctors often prescribe painkillers, anti-inflammatory drugs, or even injections, thinking the problem is arthritis or wear and tear. But in many cases, the real issue is that the joints are starving for the nutrient that keeps cartilage and bones strong. A 2019 study in the American Journal of Clinical Nutrition followed more than 3,000 adults over 65. Researchers found that those with the lowest levels of this vitamin were nearly 3 times more likely to suffer from chronic knee or hip pain compared to those with healthy levels. Even more striking, when deficiency was corrected, more than half reported significant improvement within 6 months without needing invasive procedures. Sometimes the answer isn't more pills or surgeries, it's correcting what the body has been missing all along. Now that we've uncovered the 5 hidden signs, the question becomes, what exactly is this vitamin? Why do seniors lose it so easily, and how can you restore it safely? It is vitamin D, often called the sunshine vitamin. Vitamin D does far more than keep bones strong. It regulates calcium absorption, supports cartilage repair, strengthens muscles, and controls inflammation inside the joints. Without enough of it, your entire support system, bones, joints, and muscles begins to crumble. Here is the alarming truth: nearly 70 to 80% of seniors have low vitamin D levels. Why? There are several reasons. First, aging skin doesn't produce vitamin D as efficiently from sunlight as younger skin does. By the time you reach 70, your body may be producing less than half of what it did at 30. Second, seniors often spend more time indoors, whether for comfort, limited mobility, or safety. Less sun means less vitamin D. Third, diet plays a role. Very few foods naturally contain vitamin D, and unless you are eating fatty fish like salmon or sardines several times a week, you are probably not getting enough from food alone. Finally, certain medications common among seniors, such as cholesterol drugs, blood pressure pills, and even some diabetes medications, can interfere with vitamin D absorption. The combination of these factors means deficiency is almost guaranteed unless you take active steps to prevent it, and the results are devastating. Research shows seniors with vitamin D deficiency face twice the risk of fractures and falls, a 60% higher rate of joint pain and stiffness. a significantly increased chance of needing joint replacement surgery. Later in life, this is why correcting vitamin D deficiency can be life-changing. For many seniors, it is not arthritis, not bad luck, not even aging that causes their joint suffering. It is simply a lack of this critical vitamin. But here's the good news. Vitamin D deficiency is one of the easiest problems to fix once you know the right steps. In the next part, we will uncover the hidden everyday habits and foods that quietly drain vitamin D from your body, and what you must stop doing immediately if you want your joints to stay strong. Now that we know vitamin D is the crucial nutrient behind joint strength, the next question is, why do so many seniors lose it so quickly? Beyond aging skin and less sunlight, there are hidden everyday habits and foods that quietly drain vitamin D from the body. The first thief is overuse of sunscreen. While sunscreen is important for preventing skin cancer, many seniors apply it even during short periods outside. Sunscreen blocks up to 95% of the UVB rays your body needs to make vitamin D. Just 10 to 15 minutes of direct sunlight on the arms and legs a few times a week can often provide enough, yet when every bit of skin is covered, your vitamin D production shuts down. The second thief is processed foods. Diets heavy in packaged snacks, sugary cereals, or fast food are often missing the healthy fats needed for vitamin D absorption. Without fat, your body cannot properly use the vitamin D you get from sunlight or supplements. The third thief is alcohol. Studies show that regular alcohol use interferes with vitamin D metabolism in the liver, reducing active levels in the blood. Even moderate drinking can lower your body's supply. The fourth thief is lack of magnesium. Magnesium is the helper mineral your body needs to convert vitamin D into its active form. Without it, even if you take supplements, the vitamin D remains inactive and useless for your joints. Sadly, most seniors are magnesium deficient as well. Finally, there are medications. Common prescriptions like corticosteroids, some cholesterol drugs, and certain anti-seizure medications reduce vitamin D absorption or increase its breakdown in the body. Seniors taking multiple medications are at especially high risk. Let's focus on the practical steps to restore it safely and effectively so your joints can recover their strength. Step 1 is testing. A simple blood test called the 25-hydroxy vitamin D test reveals your levels. Most experts agree seniors should aim for at least 30 nanograms per milliliter, with some research suggesting 40 to 60, maybe even more protective for joint and bone health. Without this test, you are guessing in the dark. Step 2 is sunlight. Short, regular exposure is the most natural way to boost vitamin D. 10 to 15 minutes of direct sun on the arms and legs, 2 to 3 times per week, is often enough. The key is consistency, not long sessions that risk sunburn. Step 3 is diet. Foods rich in vitamin D include salmon, sardines, mackerel, egg yolks, and fortified dairy. Seniors who add these foods to their weekly meals often notice improved energy and less stiffness, but food alone rarely provides enough. Step 4 is supplementation. For most adults over 60, experts recommend between 800 and 2000 IU of vitamin D3 daily, depending on blood test results. D3 is the form your body absorbs best. Importantly, vitamin D works best with vitamin K2 and magnesium, which help move calcium into the bones and activate the vitamin inside your cells. Step 5 is movement. Vitamin D strengthens joints, but you must give those joints a reason to stay strong. Simple weight-bearing exercises like walking, resistance bands, or gentle squats send signals to the body that your bones and cartilage need reinforcement. Research shows seniors who combined vitamin D supplementation with strength exercises saw 30% fewer falls and stronger mobility scores within a year. Finally, step 6 is regular monitoring. Seniors taking supplements should recheck vitamin D levels every 6 months to make sure they are in the safe range. Too little keeps you weak, but too much can also cause problems. The key is balance. So, here's the lesson. Don't let joint pain, stiffness, or weakness define your later years. Don't accept just aging as the explanation. Ask questions, get tested, take action. Your joints are not doomed to fail. They are waiting for the fuel they need to stay strong. Now we want to hear from you. Have you ever had your vitamin D checked? Have you noticed changes in your joints, balance, or energy that might be connected to deficiency? We read and respond to every comment, and your experience might inspire another senior to take control of their health. And don't forget to like this video and subscribe for more science-backed senior health tips. Modern medicine is powerful, but sometimes the simplest answers, the ones hidden in nutrition and lifestyle, are the most effective. Remember, your body is resilient. Your joints are not beyond repair. With the right support, you can walk stronger, move freer, and live longer with less pain. Age is not the end. With the right choices, it can be the beginning of your strongest years. Thank you for watching.